Welcome to the lifting clinic for October. So this is the second round that we're doing on this, and we'll be discussing the squat, the bench, the deadlift as we did last time, but we're also going to include the warm-ups that we discussed. I'm actually going to show you how we implement those today for the three lifts and how we can get properly ready for those movements. So Jagdeep's my intern. This is Jagdeep. He's actually going to be our role model today. He's going to show us the technique and show us the movements as I discuss it and talk about it. So we're going to talk squat first, then we'll go to bench, then we'll go to deadlift. So with the squat, as I've shown on the last months, but I'll talk about it again if you didn't get to see those Facebook Live videos. We have two main positions. We have high bar, low bar squat that changes the focus on the muscles a little bit from either being a really quad dominant or being a little bit more glute and hamstring dominant on the movement. So we'll demonstrate those in a second, but in order to warm that up correctly, we want to get everything engaged, have a nice rigid torso, nice strong core, so that when we do this lift, our legs can push against the ground and our torso stays nice and rigid, nice and tight, and actually moves without any flexion happening. Because if that flexion happens, we get that shear force created in the spine, and that's where we start to get injuries. Most commonly, we see that in the low back. So to probably warm that up, we're going to go towards the treadmill. So if you want to follow me there, we'll show you how we correctly get the heart rate up slightly and activate some of these muscles. So, do you want to treadmill? All right, go ahead, Jagdeep. We're going to put this band on you. So we're going to put a resistance band on top of the knees, just the very low part of the thigh. This is a mini band. Now these come in different shapes and sizes. This rubber one, actually, go careful, it might grab your hairs. We're then going to put our treadmill on for a slow walk. Okay, about 2.5 miles an hour. And what I'm going to cue here is to keep the legs wide. Okay, what that does is engage glute medius, which is our hips on the lateral side, to kind of warm those up and activate those muscles. To make it a little bit more challenging, we're going to increase the incline. Okay, so we'll do this for 2 minutes. He's already into the first 30 seconds. It won't take long for his legs to start feeling this. He's probably already starting to get a lot of activation of blood flow to the hips, and they're starting to get warm. Now again, this is key when we're doing a squat, because and we'll show you in a second, but as we get into that depth, we want external rotation. So the leg should actually be trying to go wide the whole time during the squat. So we push out and we externally rotate on the floor as we go down. So we're just priming this, and we've got about 1 more minute. We add in the incline just so it increases the demand against gravity, just makes it a little bit harder. The gastro leg, the quads, they're all working a little bit harder. The hips at the front have to pick up a little bit higher to get out of the way of the floor. And so just in general, there's a little bit more work happening. And how are you feeling there, Jagdeep? Is it starting to warm up? Good. And again, we're just trying to emphasize the full width, trying to get a wide foot position. It kind of seems weird when you're walking like this, but that's how we're really engaging those muscles and getting activated. It only takes about 2 minutes, and his heart rate's going to be up, and he's going to be ready to actually apply this in the lift. Isn't that crazy? We're already there. There's 2 minutes. So that comes off. You can take that band off your legs, and we've got this warmed up. Okay, we still got a little bit more to do though. We still need the core warm, and we still need to get the mobility at the joints happening. So that's what we're going to do next. We're going to go back into the weight room. And I'm going to get you to do a stir the pot exercise. So we'll use a stability ball. I'm going to put that on the floor. Go ahead and show them what a stir the pot is. It's a plank position, forearms on the ball. We're going to really stabilize here. We're going to try to have no movement at the hips, stabilizing into the ground, and a small clockwise, 5 reps or so, 5 counterclockwise. So just back and forth here, and what this is doing, you can see his body wants to move out of this control position. He's really tensing that core to maintain positioning, which is exactly what you do when you squat. Okay, we're here, and the barbell's wanting to pull us down, and we're going to fight against that and stay really strong. So we're training and warming up the body to do exactly that, stay rigid, and you see he's starting to shake, and it's starting to get hard here as he maintains that positioning. So once you've got 5 each side, I'm not sure where you're at, Jagdeep.
Yeah.
Go ahead and put knee down or come up. Great exercise. You can do a couple rounds of this if you like. You don't have to do one set. You can do several. But there's your demo, nice and easy. Next up, we want to make sure that we can get into the full depth of the position in the squat. Okay, so when we get down there, are we going to be balanced, and are we going to be correctly activated? So what we want to do is a body weight squat. Now just to counterbalance here, I'm going to give Jagdeep a little weight to come in front of him, and go ahead and do a goblet squat. So we're going to have weight in front, and then squatting down into a really nice low position. Elbows are inside of our knees, and we're just getting the mobility here at the hips. Can we get low enough? Are our ankles allowing this? Toby, watch out the way. He's at your height, huh?
Yeah.
He's saying hi. So in this position, the hips are getting the right mobility and stretching, and his ankles are getting that mobility too. So this is a great one. We also we can push out our elbows into our knees and really stretch the groin here as well. If you're struggling to get this depth and can maintain a straight back, come up slightly and lean onto those onto the knees and work the ankle mobility. So pushing to one side. He's going to lean to one side and until his heel comes up slightly. Okay, this is putting a lot of stress on the front of the ankle, which is, if you have a bad squat, it commonly comes down to the ankle mobility. Okay, so he's lifting the heel up slightly. Now he's going to try to relax at that angle and try to get the heel back down. So we're getting a stretch happening. He's going to lean over to a point where it's pulled up the heel, and now he's going to try to stretch that heel back to the ground and then go on to the other side. He's using his elbow weight here with the weight that I've given him and all of his weight leaning into the knee, adding stress to the ankle. Then he can hopefully have a stretch happening. It takes about 30 seconds to a minute for it actually to relax and let go. Ankles want to be stiff in general. So creating that mobility at the ankle. Once you're there, go back into that normal squat position, elbows inside of knees. And he's really easy to get into that position now. Okay, stand all the way up. Whew, legs probably burning from that. Thank you. So that's the warm-up I would recommend. 2 minutes on a treadmill. Do some stir the pot exercise to activate core, stabilizing, and then making sure we can get the mobility to have a good deep squat. At that point, we're ready to actually do the squat. Now, I would always recommend we start with zero weight on the bar. And I think we've got time, so actually let's do that. Let's take the weight off. So there are two positions that you can do, as I've mentioned in the previous clinic. We can do high bar squat, we can do low bar squat. Okay? High bar squat, I think is what you prefer, isn't it? You do high bar. So go ahead and show them what high bar squat looks like. So this is where the bar goes onto the traps, this big muscle on the back of our shoulders. That's where it's positioned. From there, we want to make sure we create a wedge. Okay, this means our elbows, we're going to pull in to each other. Creating nice tension. Hold in here. Nice tension. So these muscles become really solid and hard because we're pulling. Okay, once you get a nice tense muscle, it gets hard. That's creating a better platform for him, and he's getting nice and rigid. Then goes, how wide do we put our foot position? Okay, when we're doing a squat, we want it slightly wider than hip width apart. Okay, and it will vary based on your leg mass. Okay, if you have really big legs, you've got to go a little bit wider or they'll get in the way of each other. It will go on limb length, how much external rotation we're able to actually create. And it's going to work on your hip socket joint. Okay, if you have a really deep socket, it's very limiting on it's a lot easier to get in the way of your hip. So your hip bone here and your femur comes in and it can actually impede and hit itself. So if it does that, we want to have a wider position to bring it out so it actually has easier mobility in that joint. I don't think that's an issue. Generally, you can also have a shallow hip, so think of it as it doesn't go as deep into that socket, and it's really easy to move around, and you're going to have very little mobility issues if that's the case. So every person's just slightly different, and so we have different widths based on that. You want to be comfortable. So roughly it's about hip width apart. We do want a toes wider. We want external rotation. The whole part why we warmed up with the band on the treadmill is to activate these glute medius muscles. Okay, so in order to activate, we've got to externally rotate. So we're bringing those toes out, we're turning the whole leg out slightly, and that's something that we do when we actually squat. We want to corkscrew into the ground. We want to externally rotate, and that first portion, as we start that external rotation, starts to bend in the knee. So we're at high bar squat. When we squat, weight should always be in the center of our gravity, okay? Center of mass. That's where we're balanced, and we can push away from there with the most force. So if you were to take a side view on this, that bar should be directly in line with the center of his foot. When you look at a foot, it's a tripod is the stance that you should have. The heel, base of the heel, the base of the little toe, the base of the big toe. We want weight right in the middle. Okay, often you hear cues like go to the heels, okay, get off the toes. That's only because most general people put too much weight in the toes. And they say, get to the heels. But really, the cue is right in the middle. And we just cue based on that. It's a relative thing. Okay, someone's really toe heavy, we'll say come to the heels to get them closer to the middle. If they're really heel heavy, we'll say go closer to the toes. Again, it's just getting it to the middle and having a nice stable platform. Okay, so we're in this position. I want to externally rotate. It's going to start the knee to bend and break into that squat. And you're going to go nice and deep. And I want you to pause at the bottom. So go ahead and show that. Good. Okay, so now we pause at the bottom. What we can do here is analyze, is his feet equal on weight distribution? To me, actually, it looks a little toe heavy here. Okay, his heel wants to come up a little bit, so I'm going to ask him just pull his weight back a little bit and come, there we go. And now it's equal on the foot. So we're just analyzing here, is everything good? I also want to look right to left. Is he leaning one side heavier than the other? If that's the case, he's going to have some sort of over-activation in one side of the body versus the other. Come on all the way up. Good. We're making him tired holding these positions. Okay? So, again, to start with a light, zero-weight barbell. Get the technique right. Get your balance right, and then the activation that comes from that. Go ahead and go down again, trying to get right onto that center of gravity. Even pressure, heels to toes, good. Push that butt back a little bit. You had it there, right there, good. Then right to left, can we spot, is it equal? It looks pretty good. Come on up. And now we're ready to add weight and continue this, what's called activation or potentiation, to increase weight just slowly and slowly and slowly until we get to maximal weight. And we are talking about max weight here, so it is not necessarily, this whole clinic is about weightlifting and how strong you can be. There are different rules when it comes to special populations. If you have mobility issues, if you have back issues, they're going to be slightly different rules to this, but we're talking about the most optimum, efficient position to lift weight. Now the other option we have is that low bar squat. So go ahead and rack it. Okay, so low bar squat, we're going to put the bar onto the spine of our scapula and the posterior delt. So it's a little bit lower. Go ahead. We're going to come down, and it's right here. So you see it was here before on the traps. Now it's on the spine of the scapula, that bony portion. You can probably feel it on yourself over here. And then the posterior delt, so the big back of the shoulder muscle. We're again going to pull up and in with the arms and the elbows. Again, getting activation. This causes the lats to be really strong. We're pulling down, which is a lat movement, right? If we do a pull up or a lat pull down exercise, pulls the elbows in towards the hip, we're going to activate this big lat muscle. This lat runs from the hip bone all the way up to the inside of our humerus. Okay, what that does is, yes, it causes adduction extension in the shoulder, but it also is an extensor of the spine. So it's keeping him rigid, it's keeping him upright. So it's nice and strong. Because again, if we look at this from the side view, this bar is lower on his body now than it was on the trap. So come on out and get into a squat position. Because it's lower down and we still have the main center of gravity, weight over the middle of the foot, he's going to have to lean over a little bit. Because it was high up on his body, now it's lower, he's got to tilt his whole torso slightly, which puts more stress on the low back, but it puts more pressure into the glutes. Okay, what's bigger, the glutes or the quads? Glutes, okay, they're the biggest muscle we have in the body. So this generally is a stronger position. You see all the strongest lifts happening in a low bar position. Okay, because we get to emphasize the bigger muscle group. So from that position, go ahead, nice and tight, big breath in, drop down to the bottom of that squat. Good, weight goes back a little bit. Good. Again, we're analyzing at the bottom, is the weight equal on the foot, front to back, right to left, and then coming back up. Good. And so I cued breath there. Okay, it's important that we breathe in before we squat. Okay, again, this is to help the torso rigidity. Okay, it's to keep nice and strong. If we're creating as much pressure we can, we don't want that torso to bend, we can add pressure by just breathing in. We got more pressure going in, we then push that out on top of, to the abdomen wall. So you basically want to be big fat man. Okay, you want to push the belly out. Okay, if you push the belly out, it's very hard to bend. Okay, you can't bend the spine if your belly's big. Okay, so you want to breathe in, nice and tight, squeeze the muscles, and then push the air into the belly, then descend. So big breath in, push out, come back onto those heels, get balanced. Now Jagsy doesn't normally do the low bar, so this is new to him. He's learning with me. Good. And we're pushing those knees wide, corkscrewing into the ground, and then we push away. Coming up, breathing out as we come up. Go ahead and rack it. I'll let you have a rest. Those legs are hitting me. Okay, so that's the squat, both high bar and low bar, the warm-ups involved.